Who should you see for your back or neck pain and how much will it cost? Today we're going to let you know. It's Dr. David Koivuranta at the Toronto Neck and Back Pain Clinic. 30 years ago, I went to school in the US and it's a totally different healthcare system. But even though our Ontario system has its benefits, it's sometimes a bit confusing to navigate, so I'm going to break it down for you. In Ontario, chiropractors are primary care providers, meaning that you can access them without a referral. In fact, it's one of the few specialists you can see that you don't need to see your family doctor first. Chiropractors are indeed doctors and are regulated under the Ministry of Health. In some ways, chiropractic is a specialty like an orthopedic surgeon or cardiologist, except chiropractors don't use medications or surgeries in their treatments, it's all hands on. And while family doctors are more like general practitioners trying to help people with many kinds of health conditions, chiropractors are known for their help with back pain, neck pain, and related problems that come from those areas. That doesn't mean that chiropractic care can't help with other problems as well, but people generally associate chiropractic with back and neck pain for sure. Let's look at what each practitioner and therapist has to offer when it comes to neck and back pain, as well as the varied costs. Medical doctors can generally help with the symptoms of neck and back pain, usually with prescriptions or over the counter suggestions for blocking the pain or decreasing the inflammation. This is helpful, but does not fix the underlying problem in many cases. In terms of cost, you can see your doctor for free in Ontario, but you'll likely have to pay for the medications unless they're covered on your extended health insurance plan. Your family doctor can also refer you to a neurologist, orthopedist, or physiotherapist. The neurologist is also likely to prescribe something and, if warranted, consider surgery, which should be a last resort whenever possible. An orthopedist would be similar in this regard, but instead of focusing on the nerves, they'll likely focus on the bones, joints, and other tissues involved. For either visit, it will be covered by your provincial healthcare plan. You'll just have to deal with the wait time, which can be weeks, but more often even months. A physiotherapist can provide you with access to modalities like muscle stimulation, therapeutic ultrasound, shockwave, and more. They'll likely also go through and provide various self-care exercises. An initial visit will cost from $125 to $175, and subsequent treatments are from $75 to $100 depending on the appointment length. You can usually schedule an appointment within a week, and your extended health insurance plan usually includes some amount of coverage. A registered massage therapist will cover treatment that focuses on the soft tissues like muscle and connective tissues like tendons and fascia. They too will likely give some exercise and lifestyle guidance. On average, an hour massage in the Toronto area costs from $125 to $140. You can often schedule an appointment within a week, and again, many extended health insurance plans have some massage therapy coverage. Chiropractor will focus on the bone, joint, and nerve component of a condition, especially when it comes to back pain and neck pain. The goal is to improve joint function so that the area can work better and take pressure or stress off muscles, tendons, connective tissue, and nerves. Common self-care strategies and lifestyle advice or guidance is often provided. An initial assessment and treatment can range from $50 to more than $200. New patients are usually scheduled within a week, and many extended health insurance plans have some chiropractic coverage available. In terms of chiropractic care, there are also different options available for patients based on the purpose of the care provided. At the Toronto Neck and Back Pain Clinic, we've chosen a niche of pain relief for neck and back pain. Other clinics may offer more wellness-based care or corrective type care that is known to be more like orthodontics for the spine and is designed to improve the structure and function of the spine or over a period of months or years. At our clinic, we offer similar hands-on care, but with no unnecessary long-term commitments, rather the goal of short-term relief care that is convenient, affordable, and mainstream. We'll try to make you feel better on as few visits as possible based on the problem that you have. And there's no right or wrong option when it comes to choosing which type of chiropractor you want to see. It's more a matter of finding the right one for you. Only about 0.2% of chiropractors in North America belong to ChiroTrust, where we pledge to focus on short-term care with no unnecessary long-term treatment plans or therapies. You can get better, then come back when you need or want us again. When it comes to cost and insurance coverage for chiropractic care, there are generally three types of patients. Those with top coverage that usually covers all their care to get them feeling better. Those with average coverage that usually helps with most of their care, but there may be a copay of $5 to $10 per treatment, and treatment may be limited to a number of sessions. And then those with low or no coverage, where there will be some out of pocket payment for some or all of the treatments. In either case, we won't waste your time or money in trying to get you better based on your coverage amount, which is especially valuable if you don't have any coverage at all. In contrast, physiotherapy usually has more dollar amount coverage than chiropractic in many plans, but can be more costly per visit, while medical care and advice will be covered by your provincial health coverage or OHIP, but quite often excludes the medication costs. Many people we see at the clinic have come by way of referral, either by other patients or by their doctor. And even other patients have done or tried getting treatments and seen some improvement in results, but aren't quite as good as they'd like to be, or they inherently feel like something is still missing or not working quite right, so now they're giving chiropractic a try. In any scenario, new patients are always welcome at the clinic. And there you have a sense of what's available to help get you better with your neck and back pain. There's lots of options, and all of them have merit. It's a matter of deciding what care and what result or outcome is right for you. So if you have neck or back pain and you're looking for relief, you really should consider our convenient, affordable, and mainstream option. I think you'll be glad you did. Give us a call at 416-960-9355 to schedule. A receptionist will answer 24 hours a day. Or you can visit our online information center at dkchiroblog.com to see some excellent articles or information, and where you can also schedule an appointment online. Take care and be well.